For my fourth topic, I chose sleep because it's genuinely something I struggle with quite a lot. I have always been a night owl, and I often stay up way too late in an attempt to make up for my own perceived loss of time during the day. I know it affects my mental well being, but I still continue to do it. And doing the readings for that week made me a bit more cognizant that I should try and change. I will be starting clinicals soon, and I need to be there for my patients. This means taking steps to get a better sleep. So, a key takeaway from my research is just how prevalent that a lack of sleep is for nurses. The Cox et al. Article reported that 70% of nurses that they surveyed in a hospital setting reported a poor quality of sleep on average. This is an issue because there are implications for your patient if you have a lack of sleep. As the Matriciani article states that having chronic sleep deprivation is similar to that of being intoxicated and can lead to medical errors, meaning that patient safety is compromised. And then sleep directly connects to the six pillars of health because it is one of the pillars. I find that when my sleep is thrown off, that all my other pillars start to crumble. And I just need to be aware that I need to get a better sleep in order to have better stress management pillar, better social connection pillar. Almost all the pillars are affected by it. So it's just something I need to be aware of and continue to work on to get a better sleep. And then just for a lingering question, I think one thing I'm curious about is how do maybe the different shifts affect your sleep differently? Like there's the continental 2 days, 2 nights, 4 or 5 or whatever off. And then I've heard shifts so there's like 3 on, 3 off or whatever. There's a lot of different shifts you can have, or like 2 weeks days, 2 weeks nights, that sort of thing. How do those affect our sleep differently as nurses? I think what this topic has shown me as just a final reflection is that sleep isn't just a wellness choice, it's a safety requirement in nursing. I could go without sleep and it affect me, that's fine. But if it affects my patients, then it's not fine. I need to be aware that it will affect my patients and I have to be ready to change my sleep cycles.